Good morning. Oh, good afternoon. It is now 12. I'm just going to wait for a couple of people to come on. Even if it's like one person, that's good enough. So we'll wait a little bit. Good afternoon. I hope you guys are having a great Saturday. Hope you guys have some fun plans for this weekend. I'm in New Jersey, so it's really nice out here this weekend. I'm looking forward to doing something, anything. I'm so tired of bad weather, but I am coming to you guys today. Now that we have a couple people in the room, I'm coming to you guys today in honor of Black Maternal Health Week. So I'm very, very excited about, number one, the opportunity from the National Black Doulas. I love that they open up their forum to the members. So I've been a member now for probably about 2 years. And this is the second time that they've invited me to speak. So I really appreciate Tracie and how she makes sure to give us the opportunity to mingle and get to know each other. But my name is Shanita Joy. I am the CEO of Choosing Joy. It's just me in my doula practice. I am a certified doula for birth, postpartum, also lactation certified and working towards my IBCLC. And then I'm also a certified perinatal nutrition educator and a birth educator. So I got a little bit of everything going on under my belt. My actual, before the doula work, I was an RN. Well, I still am an RN. I keep my license current, but I'm not affiliated with a hospital right now. So my tag is at @the_RN doula. And I think I found a really nice way to kind of marry the two, the realm of being an RN and the realm of being a doula. They are super different, but I have found a nice way to marry the two and be able to cater to my clientele. So when I was asked to speak this week, immediately when I got the email, I'm like, oh gosh, what am I going to talk about? Like, my inclination is to always say yes. I feel like I'm in a yes season. And in typical me, I would be like, no, I don't want to. I'm scared. I'm over that now. So my inclination was, of course, yes. But it's like, okay, what can I talk about that's going to be impactful and actually make a difference during this week? And after thinking for a little bit, the first thing that came to my mind was blood pressure and pregnancy. That is a really, really, really big topic right now. I'm having clients that are having issues with just white coat syndrome. You know, they might go to the doctor, the blood pressure is elevated for that one time. I'm having clients that actually have had preeclampsia. I've had clients that have just maybe had what was the preliminary diagnosis of chronic hypertension. I've had clients that have had postpartum preeclampsia. So the gamut of the whole thing, it's definitely a big issue. And I myself have dealt with blood pressure issues during my pregnancies. So I have 4 daughters. My oldest is 19. My youngest is 4 years old. And I've been on blood pressure medicine since I had my 4-year-old. So just to kind of start with the overview, I want to talk about what is blood pressure, because some people have no clue. Blood pressure simply is the pressure that is exerted from the blood on our artery walls. So inside our artery walls, I have my nice little heart. This is actually a vase. So inside our artery walls, this would be an example of like an artery. And inside our walls, we have what's called a lumen, which can dilate, get bigger, or it can constrict, get smaller. And so that is essentially blood pressure, just the measurement of what that pressure is at any given time. It's a dynamic number, so that's why when you take it, sometimes it'll be one number, and the next time you take it, it'll be another number. It's not like a static number. But it's the force of circulating blood. If you see me looking down, I got my notes. I'm a note girl. With 4 kids and a husband, I have to keep myself on track. So, let's just talk about the 2 numbers. So in a blood pressure reading, you have 2 numbers. You have your top number and you have your bottom number. The top number is called the systolic blood pressure. the bottom number is called the diastolic blood pressure. What does all of this mean? In plain English, the systolic blood pressure, that is a measurement of what happens when the heart is contracting. So, back to our little heart, this is the left ventricle. The left ventricle, when it goes to pump out blood to the rest of the body, that's a contraction. That's the systolic number. When it is filling, so when it's just filling with blood in between, that is called diastolic. So the top number is naturally higher because it's pumping out the blood. The bottom number is typically lower because it's just at a resting state. So now that we know what blood pressure is, we need to now talk about normal blood pressure, because I can remember when I was in nursing school, normal blood pressure was like 120/80. That was gold. And this was many years ago. I've been a nurse for 15 years. So that was that target number. Now it's becoming even more of an issue. So when I sat down to pull stats and kind of get the newer understanding of what's going on, because I guess I'm a little bit of a dinosaur. But when I pulled the stats to get that newer understanding, I was looking at the American College of Cardiology. I was looking at the American Heart Association. There was European Society of Cardiology. Delved into the CDC a little bit. Ain't nobody messing with the CDC right now because they all over the place. But, you know, they kept popping up. So I'm like, all right, let me see what they talking about. So delved into that a little bit as well. But according to the American College of Cardiology and the American Heart Association, normal blood pressure is now less than 120 systolic, so that's our top number, and less than 80 diastolic, which I was like, well, dang, what? I don't stand a chance. Okay, so now that we know that, that's our target. 106/75 Moonflower Herbal Wellness says that's excellent. That's a great blood pressure. And just like for a point of reference, a lot of times people are concerned if there's like a blood pressure of 95/60. Your blood pressure, a lot of times you'll see it lower in athletes. You'll see a lower heart rate in athletes. And all that simply means is that it's less work that your heart has to do. The higher the pressure is, the more work that the heart has to do. So I don't want to get all technical with all my nurse stuff, because one thing about it, I don't know if you can tell, but I love, let me just divert this over here for a minute. I got all my little gadgets. I love anatomy and physiology. So this could get real deep, but I don't want to do that. I want to make it simple. But so elevated blood pressure would then begin at 120 to 129. And then the diastolic is still less than 80. Hypertension 1 and 2. Those are the two categories that they have now. Hey, Candace. Fellow doula from Baby Please Birth Services is in the chat. Ran by my mentor, Michelle Gabrielle Caldwell. I appreciate her so much. And honestly, this kind of came from that as well, because Michelle and I were having a conversation about how our moms are coming into birth so much sicker with these comorbidities, as we call it in medicine, these other underlying issues and health problems. And so these are all things that add to this bigger picture of this Black maternal mortality rate and what we're seeing with women of color. So hypertension 1 numbers are, when I'm relaxed and do breathing exercises, I'm 96. That's excellent. See, I need to be an athlete, girl, because I'm not even going to tell you what my blood pressure is sometimes. But I am, my mom was hypertensive, more so the type that if she lost weight, she would, her blood pressure would come down. So if you lose like 5-10 pounds, you can take off 10 millimeters of mercury. That's the measurement of blood pressure. So that weight loss is a big deal. And my dad was what is called a malignant hypertensive. I don't know if they use that term anymore. That might be a little bit dated. But my dad was super fit, was an athlete, golf player, busy all the time. But he was on blood pressure medication his whole life. It was not something he could come off. So I've always been very acutely aware of blood pressure, because I've known that my parents were on blood pressure medication. I've watched, my mom was a nurse, so blood pressure was it was something I was very aware of growing up. But back to hypertension 1 and 2. So hypertension 1, the first category would be 130 to 139 for the top number, and then 80 to 89 for that second number, that diastolic number. And then for hypertension 2, we have individuals that are greater than 140. And we have individuals that are greater than or equal to, so greater than or equal to 140 and greater than or equal to 90. And obviously that is not what we want to see for our blood pressure. So they call hypertension the silent killer. Why? Because a lot of times we walk around with hypertension and we have no clue that we have it. You could just simply have a headache, vision changes, sometimes lightheadedness. So all these various things that me personally, I have really bad allergies. So sometimes you may write it off as bad allergies. You might write it off as a sinus headache or whatever the case may be. And you're not aware that your blood pressure is up. I think it's very important in this live that I'm doing. I want to help you recognize and help clients recognize signs and symptoms and just have an understanding of what is your baseline even going into pregnancy, right? Pre-pregnancy is very important to know what is your baseline blood pressure. A lot of people have no clue what that is. And so the first question that pops into my head when I have a client, and most of my clients sign on around the time that the gestational hypertension or the preeclampsia issues would be setting in, which is typically after the 20-week mark of pregnancy. So as soon as they mention certain things to me, for example, if they say they have a headache or if they say swelling or whatever the case may be, my first thought is, what is your baseline blood pressure? Have they mentioned anything about protein in your urine? So on and so forth. These things are really important, but I recommend that my clients get a blood pressure cuff, because at this point they're already coming to me, they're already pregnant. Let's back up. I recommend that you sit down with your practitioner prior to even getting pregnant. You need to have discussions about blood pressure, have discussions about gestational diabetes, have discussions about, risk factors and these kinds of things so that you can have a healthy pregnancy. These things are very important. We know our prenatal visits are very, very important. It's important for us to be following up with our doctors because I mentioned to you, particularly this situation of high blood pressure, it is a silent situation. Sometimes it's very symptomless, or sometimes the symptoms, again, a headache, you write that off. So it's very important to have those conversations with your doctor in and of advance. It would be great to just have a blood pressure cuff on standby while you're pregnant. This way, if these things are going on and I say to you, I'm your doula, you're my client, or you as the doula say to your client, hey, you're telling me you had a headache. This is maybe the second or third headache this week. How about you take your blood pressure? And it's very good to just go ahead and have those things on hand. When we talk about taking a blood pressure, another thing is people don't take their blood pressure right a lot of times. Yes, there is a correct way to take a blood pressure. I don't have my cuff with me right now. Shame on me because I got everything else. But when you put the cuff on, there's that line that goes down to the machine. You want that to be lined up with this artery. So you want that aligned. You want your arm elevated like so. You want your arm so you can rest it on a surface or whatever the case may be. You want to be sitting in a nice sitting, relaxed position. Feet flat. You want your hand heart level, right? It doesn't have to necessarily be that high, but you want the arm elevated. You want to be quiet. You don't want to be talking. Me personally, a lot of times I don't know what it is in my household, but when I sit down to take my blood pressure, my 4-year-old wants to run over to me and she wants me to hold her. And I'm just like, oh, crap, because I want to hold her. But now I'm taking my blood pressure. So at that time, you want to be able to minimize distraction. You want to be able to minimize any talking, all that kind of stuff. If you're bent over, whatever the case may be, it's going to make the blood flow more challenging. So if everything is just kind of relaxed, you're relaxed. You also, let me back this up. A lot of times when my clients go to the doctor's office, they come up with higher readings. Some people have the whole white coat syndrome thing going on. I know I do. And it's typically around my pregnancies and things of that nature. So when I go to the doctor regularly, my blood pressure is usually, fine as long as I take my medication. But sometimes with my pregnancy, whether I take my medication or not, only one of my pregnancies I did have to be on blood pressure medication. But I would go into the doctor's office, I'd be running around crazy, and I sit down to now take my blood pressure. and it's super high. I just got there. I kind of need time to unwind. My doctor knows that I have this white coat syndrome thing, and we laugh about it actually, because why am I a whole nurse? Why do I have a whole RN and a whole BSN and I'm afraid of doctors? It's not so much being afraid of the doctor, right? I think for me, it would just be the anxiety around, okay, this is a pregnancy checkup. How's the baby? What's the heart rate doing? Is everything okay? Is growth on target? Like, I have all these things on my mind. So when I go on there, I'm coming in with stressors already. So it's nice to minimize that. And if you know you're one of those people that you're coming in with stressors and you're just sitting down, you can say to your doctor, hey, can we just take a minute real quick and do it maybe at the end of the visit, or whatever the case may be. Or if you're somebody that knows that, I don't know, you have issues with the check, or that brings you anxiety, like, you have to kind of try to bring your stress level down. I know that's easier said than done. Trust me, as somebody that deals with hypertension, is much easier said than done. And also, if you get a high reading, it's important to make sure that you're using the appropriate cuff. So a larger cuff, if the cuff is too big, it can give you a false low. A smaller cuff, if the cuff is too small, it can give you a false high. So you want to make sure it fits your arm. And then you also want to make sure that if you're consistently getting high readings, when they have like the community outreaches and the health fairs and things of that nature, it's great to go and learn how to take a manual blood pressure. I cannot tell you how many times I've sat down to take a digital blood pressure, and then I go and have it done manually, because like I said, my mom was a nurse. So I would be like, can you check this for me? Or vice versa. We would check each other's blood pressure. And bam, it's not that high. So sometimes there is there's that room for error with the mechanical. I would definitely say have that backed up with an actual real reading, somebody manually doing your blood pressure. And then as far as, a lot of people will ask me, a lot of my clients will say, well, what's a good cuff to have? I'm not really big on the wrist monitors and all that kind of stuff. I like Omron. So it's spelled Omron, Omron. I don't know how the company pronounces it, but that is the one that I use for my blood pressure, and I like them very much. They do offer little discounts. Love that they're in CVS. I got a CVS right up the street. So if I have a client, or even Walmart, wherever, Walgreens, you're thinking about like just a situation where you're pregnant, you might have a headache, and you want to grab something quick, this device is in those stores. So that's awesome. You could just go grab that really quick, and that's really good to be able to kind of have that reassurance. Let me flip my page. So yeah, just the idea of blood pressure in pregnancy. During pregnancy, blood pressure will actually decrease. It has a tendency to decrease because of hormones, namely progesterone. Progesterone is a hell of a hormone, let me tell you. So that progesterone, when we talked about the arteries, I mentioned earlier the arteries, that there's a lumen to the arteries, and that artery can actually dilate and contract. In pregnancy, the arteries will dilate as a result of the progesterone. It'll relax, because the goal is to increase the blood flow to the placenta, to the uterus, to these other organs that are now going to be sustaining the life. So when we talk about just the effects of high blood pressure on, let's talk about mom, just in general. High blood pressure can cause strokes. It can cause kidney damage. So that's why we'll get into, when we get into the preeclampsia, the protein in the urine and things of that nature. Damage to the arteries. High blood pressure can cause this lovely left ventricle to hypertrophy. What does that mean? So now you have this really, really high pressure that's constantly being perceived in the heart. And what ends up happening is, our bodies are so smart and so protective, it's ridiculous. Your body, actually, the heart is going to now hypertrophy, which means the left ventricle is going to thicken. That wall of the ventricle is going to thicken. Because if it gets thicker, it's thinking that, okay, I'm going to be able to pump more efficiently. But that's not necessarily the case. And it's not the case. It's a compensatory mechanism. And with most things about our bodies, most compensatory mechanisms work until they don't work. And so it might buy you another year or two, but eventually when it crashes, it's going to crash. And that's going to be a really big issue. So we get into things like heart failure and all these other kind of issues. And just thinking about the effects of hypertension on the baby. So baby with a mother that has hypertension is going to have the issue of possibly small for gestational age. So what does that mean? The baby is not getting the appropriate nutrients. Let's just back up. We have our lovely uterus. We've got our nice little brown baby in here because representation is so very important, as we all know. And we have our placenta, right? So this placenta, this is the fetal side. This will be the maternal side. We have our one vein and our two arteries. So this is attached inside of this uterus, and this is literally the source. This is bringing nutrients to the baby, taking waste away from the baby. So this is where all this filtration takes place, through the placenta. And so if there's an issue at that placental level, there is a problem because our baby is not getting the nutrients that they need. So this is how we come into issues of the baby being small for gestational age because of that decreased blood flow. So that is obviously a big concern. So I'm going to switch gears just a little bit. We're of course still talking about our blood pressure, but I want to talk about hypertensive disorders of pregnancy, because we hear high blood pressure in pregnancy and automatically it's like, oh my God, I have preeclampsia. I had a client that was having some issues with her blood pressure, and she and I and her doctor both believed that it was very much anxiety related, things of that nature. But anytime, it's always something you look into. So I was asking her some supporting questions just to see, like, okay, what is this? Because as I mentioned, we go into our pregnancies not even knowing. And so from my own personal experiences, I had my first daughter when I was 18. And even then I could see issues with my blood pressure starting to surface. And so knowing that I was the product of two hypertensive parents is always, in the back of my mind, well, yes, you can get hypertension. But when these things start to surface in pregnancy, it can be very challenging to sort out. Is it essential hypertension? Is it what I was just talking about, which is chronic hypertension, or is this a hypertension that is related to the pregnancy? So we have to get into the mindset where we know what is our history before we come into pregnancy, because it's important to come in and say, hey, I have this issue of hypertension, right? So that we know, because when you're pregnant and you're trying to decide whether this is truly chronic hypertension or if this is a preeclampsia, is this now a preeclampsia that's superimposed on top of the chronic hypertension. So all of these things, you have to be mindful that there's levels to it. All hypertensions in pregnancy are not necessarily created equal. So let's talk about, we just discussed chronic hypertension. That is a diagnosis that occurs before 20 weeks or before the pregnancy. The goal of this TED Talk is for you to be able to go into your pregnancy knowing what are the issues, what are the things that I'm coming into this with, right? It makes life just that much easier. So that is a chronic hypertension, is one where you have already had this diagnosis. Sometimes you don't find out about the diagnosis until pregnancy. And that is essentially what was going on with me and my hypertension journey. I didn't know I had it. And so I was, my blood pressure was just doing crazy stuff. And of course, they treated me like I had preeclampsia, and they were treating me very much like that type of a case, because that's how I was presenting. It didn't really start until after the 20-week mark, so they were very concerned. Then we have gestational hypertension. It typically happens after 20 weeks. With gestational hypertension, there is no protein, there's no cardiac damage, there's no kidney damage, no kidney signs or symptoms. And it usually resolves post-pregnancy. However, there's going to be an increased risk for this individual that develops gestational hypertension. There's going to be an increased risk for this individual to move on and develop an essential hypertension, a chronic hypertension as we call it. It's not a definite, but it could possibly happen. So it's just something that's good to have into the back of your mind. Then you have preeclampsia and eclampsia. And so preeclampsia and eclampsia, this is where we have a hypertension that takes place after 20 weeks. there is protein in the urine. There can be cardiac issues going on. There can be breathing issues, lung issues, shortness of breath, things of that nature, because the lungs start to fill up with fluid. That's when we have the swelling. So we'll have the pitting swelling in our hands, in our face. Swelling in pregnancy is something that occurs. I'm sitting down right now. So let's say this is my uterus. This is my baby. They're all exerting a force right now on my 2 major arteries in my leg. They're exerting a force. So I'm sitting down at a desk. I'm doing my whatever it is, and that can cause my ankles to swell. Yes, that is something that happens in pregnancy. But what we don't want to see is this edema where you push into it, or swelling where you push into it and now it leaves the mark of your finger. That's a problem. And then we also are looking at how does it develop. So are we going to bed one night and we're waking up and it's just this crazy amount of swelling? Is it our hands and our face? That would be a good indication that that's something that needs to be mentioned to our doctor. So we have that. We have headaches. And with the headaches, it could be, they could be very, very severe over the course of a couple of days. Like one of the worst headaches you had, you're taking pain relievers, they're not resolving. We can see nausea and vomiting. We can see blurred vision and spots. We can see epigastric pain. So what is that? That's pain right here in this mid area of our stomach. We mentioned the sudden swelling, sudden weight gain. So you want to make sure everybody hates the scale at the doctor. Trust me, I hate the scale at the doctor. But in pregnancy, is very important. 2 things they do when they see you at the doctor's office that are very important. Number 1, you pee in the cup. Most of the times, nobody knows why they pee in the cup. You are peeing in the cup because they're doing a urine dipstick. What does that mean? When you pee in the cup, they now take the dipstick. It has a bunch of different little lines with colors on it. You stick it into the urine and it reacts to the urine. So what they're doing is they take that strip and they measure. You can actually pick them up yourself. They have them on Amazon, in CVS, Walgreens, Walmart. And you measure it against the colors that are on the bottle. And it's going to tell you, it's basically like a urinalysis. Do you have protein? Do you have ketones? That would be related to gestational diabetes. Do you have red blood cells? Do you have white blood cells? Do you have occult blood? Do you have, which is hidden blood? Do you have any type of, it's a bunch of different things that it measures, but everything that's on there is going to tell you, it's going to be able to tell you based on the color that you fall on, where you're at. Do you have protein? Which is something that we see with preeclampsia. So just for a little bit of understanding, like I said, I'm not going to get too deep into anatomy and physiology, but our kidneys are our filter of our body. And so what you're seeing, when you're seeing protein in the urine, you're seeing that molecule, protein, is a larger molecule, and it should not be able to be filtered out through the kidneys. So when you're seeing protein in the urine, that means that the blood pressure is so great that it's forcing those molecules through the kidneys, which should not be happening. So that is what that protein part of it is about. So that's where we have kidney damage come in, and they will look at blood levels like the creatinine. They'll look at uric acid, and this is like an indicator as to, is there kidney issues going on? So aside from that, then that's when I mentioned before, I'm gonna go back a little bit, and then we have this superimposed, right? Which superimposed basically means something that is placed on top of something else. So you come into the pregnancy with an essential or chronic hypertension, and then at some point that turns into preeclampsia. So that is a superimposed hypertension. That will be treated. It will be treated like hypertension that is of a preeclamptic nature. So with my 3rd pregnancy, I went into that pregnancy and my blood pressures were high from the gate. This was my one baby that I had to be on blood pressure medicine with throughout the entire pregnancy. They noticed that my doctor actually wanted me to go on blood pressure medication with my 2nd daughter, and I refused because I was like, no, I'm gonna, get myself together. It wasn't too bad. I was younger. I think I was about 27 when I got pregnant with Olivia, so I was a little bit younger. I was smaller, and I was eating a little bit better. So I was able to avoid the medication with Olivia, but when I had my third daughter, Phoenix, the pressures were higher. I was heavier, so I felt like it was advantageous to take the medication while I was pregnant, and knowing that my blood pressures were higher and knowing that there was this possibility of, okay, I could have a superimposed issue of preeclampsia. Let me just go ahead and be on the safe side. And so that's what I did. Fortunately, it didn't affect the pregnancy. It didn't affect her. I'm trying to think of the name of the medication that I took. I can't recall right this minute, but what I do know is that it was an alpha blocker. So prior to being pregnant, I was on a beta blocker. It was an alpha blocker. So I was taking that particular medication, and I took it throughout the whole pregnancy, and all was well. Fortunately, she was 7 pounds 6 ounces, no complications. But for me, it was just very important to know that, okay, this is a diagnosis. Now, at that point, it was pretty obvious that was my diagnosis. This is a diagnosis. These are the options. We need to know what are our options within these things, and navigating blood pressure during pregnancy, and what can we do about it? How are we going to manage this? Of course, first line defense with blood pressure being high, we should look at our diet. I like to eat, y'all, and I'm not even going to hold you, not for 1 second in this live. I like to eat. I am the product of 2 Southern parents, 1 parent of Caribbean descent. I like food. I like savory food. I'm not necessarily going to say I like salty food, but I like to eat. And if you're eating out and this, that, and the third, I'm a grab on the go kind of girl. 4 kids, I be out here. I be busy. We have very busy lifestyles. And so a lot of times what we're eating is contributing to these hypertension issues. Processed foods, things that are in cans, things that are like your soups. The Panera soup is so good. Oh my gosh. You go into the BJ's and they have it there, and they got your broccoli and cheddar soup, and you're ready to just take that thing home. Look at the sodium. Turn it around and look at the sodium. Recommendation would be that you have somewhere around 2 grams of sodium. Keep it around 2 grams of sodium a day, right? When you're looking at a heart healthy diet, they'll say, okay, we're going to put you on a 2 gram sodium diet. Okay, 2 grams of sodium. You turn that thing around and it'll tell you that's your 2 grams of sodium for the whole day, which is insane. That is insane when you start to think about how much sodium you're taking in. So we got to cut out the processed foods, anything that's being preserved, your pickles. I mean, come on, who doesn't love a good dill pickle in the summer? But you got to look at these things. You have to look at the sodium content, start turning those jars around and start looking at, and of course we need to be looking at more than that, but right now I'm focused on hypertension. So we're focusing on the sodium content. These prepackaged meals and things of that nature, things with a lot of cheese. I love cheese. Cheese is very high in sodium. Very high in sodium. One right now that comes to mind off the bat that's not Swiss cheese. I don't like Swiss cheese. I would like the one that's high in sodium because I'm a hypertensive, so why wouldn't I? But seriously, cheese is high in sodium. Bacon. I'm a big bacon girl. We got to be looking at our meats, things like bacon. Very high in sodium. So we got 2 things going on. The way we eat, the sodium content of the food in and of itself. And then we also have the issue of we don't eat the serving size. I know I don't eat the serving size. Sometimes when I finish whatever it is that I'm eating, I have eaten 3 of the serving size. That's insane. What does that look like? That looks like eating 6 pieces of bacon for breakfast. That's what that looks like. And when you turn that package around and you see how much sodium is in that bacon for 2 slices, you've now eaten about your allowance for the day. So that is a really, really big issue. We've got to be looking at these nutrition facts and seeing where we land with our sodium intake. You also want to look at, of course, fast food. Cutting out fast food, says the nurse who loves fast food. We got to cut out fast food. That's very, very important. When you look at the sodium content in those foods, a McDonald's, a Burger King, these various things, ridiculous. It's totally ridiculous. It's really good to get in the habit of meal planning, meal prepping, and doing those things at home, because you control how much sodium goes into what you're cooking. Personally, I know when I eat from home, I don't cook with any salt like that. So I will cook with sometimes like adobo or Lowry's, which I know that they have salt in it. So when I say I don't cook with any salt, I'm not adding any additional salt. I don't just have salt shakers sitting around my house. Absolutely not. For somebody like me, that's a problem. So I will cook with whatever it is. I'm not heavy-handed with whatever it is that has salt in it. I try to be very conscious of that. And so whoever is at the house, I'm like, look, it's not going to be real salty because I need to live. It's for babies running around here, and I got a husband. I need to keep myself alive and well. So we need to be thinking about all these various things when we are consuming food and portion. So look at what is actually in the food. What is the sodium content for the serving size? What is the serving size? Activity, 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 says the nurse that doesn't like activity. We are the worst patients. Let me just put that disclaimer out there. We are the worst patients, but I wanted to talk to you guys about this because I am somebody that deals with it. I deal with blood pressure. I deal with making healthy choices on a regular basis. And I'm not going to hold you. I don't always make the healthier choice, but I am moving in that direction. And one thing that I've been doing lately is that when I fail with making the healthier choices, I will be like, you know what? Okay, lunch was a fail. Let's move on to dinner. I can make a better choice for dinner. And then I do just that. Beet juice is great for lowering blood pressure. Foods with garlic in it, they're really great for lowering blood pressure. Hi, Tracie. Thank you so much for this opportunity. So just, you want to try to start incorporating these things that are good. Foods that are anti-inflammatory. When I talked about the vessel and the artery, inside the artery, our arteries can literally become inflamed after a while. So if there's inflammation, there's going to be issues and damage to the lumen of our arteries, which is going to affect our blood pressure. So these are things that we need to constantly be thinking about. Eat your anti-inflammatory foods. Eat your foods with your omega-3 fatty acids, your salmon, cod, all these various fish. You got shellfish. You could do shrimp, just things that are going to be restorative and reparative to our bodies. Water. Drink water. Drink water. That is very important. Like, I know that, at this big age, I'm 37, so at this big age, I need for us to get to a point where we realize we just got to suck it up, literally and figuratively. We may not like water, okay? But guess what? We need it. And so if this is an incentive for you to go someplace and lose weight, if you need to, and I'm saying this to me, I'm looking directly at me right now, need to, yes, coconut water as well. If you don't like the taste of regular water, I'm bougie with my little water. I put a little cucumber. I put a little lemon. I have mint. I'll put ginger. Yes, I mentioned the beets as well. I'm glad, Tracie, you said there's capsules. That's very good. Because now I'll drink the beet juice. I don't find it to be too much. You can also put it in a smoothie. That's really good. Very, very good. But the capsules, just as good too. But yes, we are 80% water. So now what research is showing is that we need to be drinking half of our body weight in water. Fluid ounces. If there was ever a time that I need to lose weight, it's now. Because it ain't no way. Again, I remember when back in the day you could drink your 8 ounces of water. They would tell you 8-ounce glasses. Boom, that's what you have a day. Not anymore. It's just not so. So we have to be mindful of these various things when we are consuming, when we are moving through life, when we are, on the run, on the go. We got to think about all these various things. Also, I wanted to talk about a different, it's more of a continuum of preeclampsia, the relationship between preeclampsia and HELP syndrome. That's another situation where there's elevated blood pressure. The relationship between the two is not totally understood from the research that I was doing. It's not totally understood, but what it is basically is it's preeclampsia, and it also has the features of hemolysis, which is increased breakdown of red blood cells, elevated liver enzymes, low platelets, so that's HELP. Hemolysis, elevated liver enzymes, and low platelets. Platelets help us to clot. Our liver is also a filter in our body, so that is a very important manufacturer of proteins and all these various things. That's very, very important that we make sure that these organs are doing what they need to be doing. So HELLP syndrome is another situation. It is very, very dangerous. It is a very big problem. We discussed preeclampsia. Also, I wanted to just mention that can progress to eclampsia, which means that now this person is having seizures. And when you get to this level, the issue with this level is, and this is why I keep impressing upon us that it's so important for us to know these things prior to going into our pregnancies. It's so important because when you get to this level, the cure is to deliver the baby, which if this is happening at 24 weeks, we know that that's a problem. Is it possible that potentially a 24-weeker can survive? Sure. But we know that that's not ideal. And then also there's the issue of just the eclamptic issue. You're having seizures now. You could potentially have a stroke when your blood pressure is too high. So these are all things that you want to be thinking about. You have the patient, which is the mom. You have the baby within the patient. What happens to maternal affects fetal. So if mom is having a stroke, baby is experiencing a lack of oxygen, a lack of blood flow. That's a huge problem. So the cure, like I said, delivering the baby, or they will give you what's called magnesium sulfate. That is a very powerful medication. It's a very powerful vasodilator. What does that mean? Back to our arteries, the lumen can constrict and it can dilate. What it basically is going to do is cause the lumens of the artery to open up so that the blood flow is not impeded, that there's no issue. It's not a higher level. It's not going to be a higher level of pressure. It's going to drop the blood pressure. But with that medication comes a lot of side effects. Being flushed, extremely hot, reflexes are going to be affected by it, super bad headache. And I had a taste of that when I came home with my fourth daughter. My blood pressure went up to about 160 over 100. Because I've had bouts of stuff with blood pressure before, I can feel when my blood pressure is up. So I felt off. I called my provider. We started a medication called nifedipine. I started taking it, and fortunately he didn't think it was anything like postpartum preeclampsia. He knew that I had that hypertensive piece already in my history, so he treated me like it was hypertension, started me on this medication. I had a wicked headache, and I mean, this was an oral medication I was taking. This magnesium sulfate that I mentioned, that's administered IV. So imagine it's going straight into your veins. Magnesium is a smooth muscle relaxant. So sometimes you will see people who have issues with hypertension or risk factors. You'll see that they might go on a calcium, magnesium. Sometimes they will go on a low dose aspirin, the 81 milligram aspirin that helps to basically make sure that clots are not being formed. And then you have the you can do things like put on your TED stockings or whatever, the thromboembolic stockings. Those are going to be like your compression tights and things of that nature when you're on your feet for too long. There are a bunch of things that you can do proactively. But all that to say that is a medication that you don't want to have to be on, because it's not a pleasant experience. It's not a pleasant medication to be on. I want to talk to you guys about risk factors, and I'm almost done. I'm wrapping up. But risk factors, if this is your first baby, if you're having multiples, if you are less than 20, and if you are greater than 40, if you have a BMI of greater than 30, which basically they're trying to say if you're fat. We know BMI does not take into account for things like density. It doesn't take into account for things like sometimes you might be tall but thin and still obviously weigh more. It doesn't take those things into account. So I really don't like to get too much into the BMI stuff, but we do know what feels healthy and what doesn't. I know when I am overweight, I can feel it. I breathe differently. I walk differently. I'm not able to be as active as I want to be. So yes, I can definitely feel it. And I feel like most people that are in tune with their bodies know what that looks like. There's also going to be people who are at risk are people who have lupus, people with pre-existing, so that chronic or essential hypertension, who already have kidney diseases, people with type 1 or type 2 diabetes. And why type 1 or type 2 diabetes? Because there's already damage to the vessels at times when there's particularly uncontrolled diabetes. So that's really important just to keep that in the back of your mind. Also, people who have the tendency to clot, so they call it thrombophilia. People that have a tendency to form and then throw blood clots, which is like a pulmonary embolism type of situation where you have the blood clots in your lungs. Those people are going to be at higher risk. So you want to think about your risk factors for that in and of itself. And then you want to think about your risk factors. Hey, am I at risk for hypertension? Is my mom hypertensive? Is my dad hypertensive? That's not to say that right off the bat, because these are your genes, this is your destiny. You know, I don't believe in that at all. I definitely believe that genes play a role. But I also know that being the product of two hypertensives, that me having certain making certain choices with my foods, things of that nature, it doesn't help, right? So I feel like I kind of fed into it a little bit. There are definitely things I could have done to ward it off, at least maybe a little bit later in life. Here's what I would suggest in terms of if you're trying to figure out whether or not you are hypertensive, and because of the relationship between hypertension and the kidney. I had this really great anesthesiologist when I was getting cortisone shots in my back for herniated disc. And so I tried the cortisone shots. They didn't work. But anyway, the anesthesiologist was saying, wow, you're so young, you have hypertension. I always get that. You're so young, you have hypertension. Yes, I have hypertension. So he said, my recommendation would be that you go and see a nephrologist. You want a nephrologist managing your hypertension. I said, okay, cool. I found one. Her name is Dr. Cindy Wu, out here in New Jersey. She's located in New Brunswick, or is that Somerset? Those two are very close to each other. So New Brunswick, Somerset area. And she has a hypertensive center. And I actually went to her because I wanted to understand, like, what is the cause of it? Because we could be having these issues, hormonal related things. We could be having it due to thyroid related issues, or just it could be idiopathic, as we say, in medicine. And what does that mean? We don't know why. This is just what happened when my mother and my father's genes came together. For me, all my test results came back clear. So what that indicated was there's nothing that's going on outside of the fact that, yes, your genes and your lifestyle right now put you in the hypertensive boat. Okay. And then at that point, she reevaluated what drug I was on to make sure it was compatible in terms of me still being childbearing age, although I'm not bearing anything else, honey. Okay. I'm not doing it. But, you know, she was like, look, you're still childbearing age. I want you to be on, you know, you can continue with this medication. All your labs came back clear. That's a really good place to start if you have a very strong family history and suspect that you have issues with blood pressure. And just to wrap it up, I'm going to mention that postpartum preeclampsia is a thing. I've had 2 clients have to be readmitted into the hospital for postpartum preeclampsia. I mentioned swelling, and I mentioned that swelling is normal when you have a baby. So when you're pregnant, you accumulate a lot of fluid. Fluid accounts for a good amount of the weight sometimes, right? When you have that baby, the fluid has to go somewhere. So the fluid will come out from sweat. It'll come out diuresis from you urinating. That's what we call it when you're releasing these extra fluids. When these extra fluids are released, this is all just getting rid of all that excess stuff that's going on in your body related to pregnancy. So yes, you can see swelling. Sometimes it will third space. What does that mean? Third spacing means that it comes out of the vessel and it's going into the tissues. So that's where we see that edema. However, again, you're not supposed to wake up one day postpartum with edema in your hands and face with the same symptoms that we went through, the headache, the nausea, the vomiting. You're not supposed to wake up with that. So I have had 2 clients that had to be readmitted. What you need to know is that preeclampsia can surface all the way up until 12 weeks postpartum. That is very important to know. So if you don't take anything else away from this, have your blood pressure cuff, Read those nutrition labels. That is very important. Stick to the serving size when we are talking about these nutrition labels. For example, I want IHOP right now, and I would love to have 6 pieces of bacon from IHOP, and I'm absolutely not going to do that. I'm going to have my 2 pieces of bacon from IHOP, because the likelihood is that the serving size is 2 pieces. So I can have what I want, I just need to have it in moderation. And then lastly, if you do have a suspected hypertension issue during pregnancy, preeclampsia, namely, they're going to be checking your blood pressure. They should be doing a manual check as well. That is important. They're going to be doing a check for urine protein, which we talked about in the office. That's the dipstick. Also, sometimes they will do a 24-hour urine. So I actually had that ran on me in my second pregnancy. They'll send you home with a nice big jug, and they want to see, are you putting out protein over the course of this 24 hours? Every urination that you have has to go into that jug for the 24-hour period. It gets sent off to the lab, and they're able to tell, are you putting out protein, which we discussed is that molecule that should not be able to filter through the kidneys. You will also see tests like creatinine and uric acid. That's going to tell us what is going on with the kidney function. So if you want to know, like, hey, I need a preeclampsia workup, that includes BP, that includes urinalysis, that includes a CBC, complete blood count with platelets, because remember we talked about HELP syndrome where we have the low platelets, so we need to see what are the platelets looking like. Creatinine and uric acid, that's going to cover us on the kidney level. And then we have ALT and AST levels. Those 2 things are going to cover us on the liver end of things, because again, in HELP we talked about hemolysis, breakdown of red blood cells, which we'll see that'll be accounted for in our CBC. And then the ALT and AST is going to tell us what is going on with the liver. Elevated liver enzymes. If these 2 things are elevated, then we know we have a problem. So if you don't take anything else away from this live, we need to know our baseline. Go get you a blood pressure cuff today. Encourage your clients to get a blood pressure cuff. It does not hurt to have. They are not expensive. If you are anything like me, you go on Amazon multiple times a day, type in Omron, OMRON, get yourself a blood pressure cuff. Know your baseline. That's very, very important. Very, very important. You want to know what is going on the maternal end, because like we talked about, when that fetal end of things, if the maternal blood flow is not right, the fetal blood flow is going to be affected. And there is research that shows that there's a connection between the way that the blood vessels develop in the placenta and the way that preeclampsia presents. A preeclamptic client is going to have a change in the blood vessels that develop. They're not going to develop the way they should. And what happens is, again, going back to that artery idea of the lumen of the artery is going to be more constricted. So that is something that you really want to make sure that you're thinking about, something that you want to make sure you get 1 placenta. So if the pregnancy happens and that placenta has not developed the way it's supposed to in terms of at the arterial level, that's going to be an issue. And that's going to be something that is going to affect our babies. And this is where we see preterm birth, small for gestational age, and then we have to have these, I talked about the magnesium sulfate, all these insane drugs that really are not pleasant drugs to be on, but at that point of being diagnosed with a preeclampsia situation, it is delivery of the baby is a cure. Get that blood pressure down before something serious happens. So if you don't take anything else away, know your blood pressure, know what your baseline is, know what your baseline heart rate is, know these various things about yourself going in, so that we can have healthier moms going into their pregnancies. Maybe there's fear around finding out if you have hypertension. Healthier moms going into pregnancies. That's going to help to combat this Black maternal mortality rate. Yes, there is racism. There's all these things. And what I find in medicine is that either overtreat us or they undertreat us. There's not a good balance in how they treat us. It's one extreme or the other, which is why we have to come in with some intrinsic knowledge about our bodies. We have to come in with some education around the issues that plague us. And it's not just Black women, but I'm talking about us in specific because it's Black Maternal Health Week. So I'm speaking about us in specific. But when I was a nurse, I saw people come in from all walks of life, and hypertension and diabetes were, and a statin, which is a cholesterol medicine. All three of those things were the three common medications that everybody had that was a common thread in every admission. So it's not just us. It's America in general. But I'm concerned about the people that look like us, because when we go into our pregnancies already sicker and already in this weakened state, we already have this issue that exists in and of itself. Healthy, whatever. But when we go into these spaces and we already have these pre-existing issues, I mean, now we're complicating the problem. And so I just want us to be mindful and for us to be able to do our parts. Of course, there's work that has to be done on legislative level. There's work that has to be done in government. There's work that has to be done around the trainings, right down to the people that teach these people about how to handle us, how to deal with us, how it's not all cookie cutter, medicine doesn't work that way. A good practitioner understands that medicine, really you have to take into account the subject. Medicine is very subjective. A good practitioner knows that. But we also have to take the responsibility to know our own bodies and to be able to say, this is not normal for me. And we also need to know what is normal for pregnancy me versus this is not normal for pregnant me. Because sure, maybe I was having headaches before. Pregnancy, you can have a headache in pregnancy from... Me personally, I have terrible sinuses, like I said earlier. You can have a headache in pregnancy from something as simple as a stuffy nose. Okay, but that is a different headache from that preeclampsia headache, from that elevated blood pressure headache. Yes, body alchemist, this is not normal for me. That is so important to be able to say that. And I also find with the Black mortality rate that a lot of times not knowing the difference between... A lot of people will have symptoms present and say, it's pregnancy. Okay, and it might be pregnancy. But if I take something to help with my headache, the headache should resolve. My sinuses should decongest. I should feel better. I should not have this headache for 3-4 days and be walking around saying, this is just pregnancy. No, ma'am. I always tell my clients at the very worst, the doctor will think you are a hypochondriac. I don't care. This is your life. This is your baby's life. There's nothing more personal than that. It is very personal when it comes to your kids. So you need to speak up. You need to make sure you say something. You have to. You just have to. Vision changes. They occur in pregnancy. My vision did some crazy stuff. And that's a normal change. You should not be seeing spots. You should not be seeing floaters. You should not have blurred vision. This shouldn't look like there's two people standing over wherever you're looking at. Absolutely not. Nausea and vomiting, that happens during pregnancy. Okay, that's fine. Typically in the first trimester, if you're eating enough protein, 60 to 100 grams a day, typically that will resolve. You're building a human. So protein is the building block of cells. You're building a human. You need to get your protein in. That's a sidebar. But okay, fine. You have this nausea and vomiting. Typically resolves in the first trimester. If you do not have a diagnosis of hyperemesis gravidum, there's no reason that as a pregnant person you should just be nauseous just because you're nauseous. That's not normal. But we have these ideas in our head. We hear different stories and we listen to different people. And that's great. Glean knowledge from different sources. But understand that you are an individual. This is not cookie cutter stuff. Yes, absolutely. Your story, Doula Services. Advocate for yourself. Advocate for yourself. Absolutely. It's not a cookie cutter situation. So listen to other pregnant moms. Sure. Listen to this one. Listen to that. Fine. You can glean all this knowledge that you want. That's great to be able to pick and choose from different sources. But you got to have that little thing inside you, that little Jiminy Cricket, that little them little things on your shoulder that's telling you like, this is not right. I'm telling you, when I came home after I had my fourth daughter and I laid down, I was just like, something is off. I don't feel right. Like, this doesn't feel like normal postpartum me. Like I said, at that point, that was my fourth daughter. So I had to kind of, I had the experience of knowing what postpartum me felt like. If it's your first child, that's going to be a little more challenging because you don't know what postpartum you feels like. But that's why it's important to listen to that little intuitive part of us. As women, we all have it. You got to listen to it. I believe as people, we all have it. But as women, we can be very connected to that a lot of times. I need you to listen to that part of you that's saying that's not normal. I'm so grateful to God that I called my doctor when I did, because like I said, my blood pressure was 160 over 100. That is an absolute problem. That is an absolute no. And here I am washing clothes and cooking dinner. Yes, I just came home from having a baby. 2 days removed. I got 3 other babies running around. I'm breastfeeding. I'm washing clothes. I'm doing stuff. My husband is like, stop. As soon as I stop one thing, I'm going to something else. As soon as I stop that, I'm going to something else. Crazy. Yes, it's so funny that you said, Body Alchemist, listen to our womb. Yes. I have this thing where I feel stuff in my womb. And I think that just comes from being a birth worker and being so connected to pregnancy and pregnant people. And I've always had this thing for pregnant people and babies and all this stuff. But yes, like, listen to that. It's literally built in for that, for these types of situations. I'm so glad I listened to my intuition, because I don't know what the end result of that could have been. I have no clue. And I'm so glad I did not find out. I'm glad I got on my medication. I am actually still, so present day, I am still on medication. And like I said, when I fall off the horse, I just get back on. I need to do a lot better, transparently speaking to you guys. I need to do a lot better with my personal eating habits. I need to do a lot better with stress eating, the relationship that I have with food and stress and things of that nature. I need to improve all those things, but I'm aware of it. And like I said, you fall down, you get back up. You fall down, you get back up. You don't have to wait till Monday to start. Don't wait till Monday. It's Saturday. Start today. Don't wait till tomorrow. Start today. Yes, Drea, same. A lot of people are in this boat. Start today. I used to have that bad habit. Okay, you know what? I'm going to start the 1st of next month. What about all the rest of these days in April? I'll be doggone if I wait till the 1st of next month. I might not be here the 1st of next month. Let's be clear. You know what I mean? These things are very important. We got to jump on that bandwagon as soon as we see these things, especially as we start to get older. You got to jump on that bandwagon as soon as you find out. You got to be like, okay, all right. I didn't do great at lunch. But guess what? My next meal, that's going to be my better. Not the 1st of May. Don't you dare wait till the 1st of May. Absolutely not. Don't do it. Next meal. If you're in the same boat as me, next meal. Do better. Because that's what I'm about to do. I'm going to have my only 2 pieces of bacon. And I want 7. I'm not going to hold y'all. I want 7. Because I like bacon. I really do. And I'm dead serious. You see this face? I'm dead serious. But I can't do it. So that is what I have for you guys today. Thank y'all so much for hanging in there with me. I can be long-winded. It's something that I'm very passionate about because I'm living it. I just popped the labetalol this morning. I just took my blood pressure medicine this morning. So I'm living it. But I just wanted to bring this topic to you guys. I wanted you guys to be aware. I wanted you to know what tests you need to ask for. I wanted you to know what signs and symptoms you need to look out for. I wanted you to know your risk factors. So if you're planning to be pregnant, you can take into account your risk factors and you can say, hey, let me mention this to my doctor because this is a risk factor. Thank you, Body Alchemist. Thank you, Moonflower Herbal Balance. Thank you, Drea. Thank you, everybody that has been just chiming in, because I do like it to be an interactive type of situation. I know it's a Saturday, y'all, and when I tell y'all the way I'm about to go get in this bed after this, I'm going to get in my bed and I'm going to relax because I'm tired. But this was just too important. Thank you, Your Story, Doula Service, for watching, for chiming in, all of you guys. I really, really appreciate that. Share it, like it, comment. Or yes, share it with your clients, please. This is how we affect change in the Black maternal mortality rate. This is how we this Black Maternal Health Week is restoring joy, right? Restoring joy. And I can't remember that last part of it, but they said restoring joy. Joy is my middle name, so anything joy, I'm like, huh? Okay, yes, restoring joy in our births, in our birth stories. How do we restore joy in our birth stories? By going in our births the healthiest version that we possibly can of ourselves. That's how we restore joy, because now we're not focusing on sickness when we go into these pregnancies. Sickness is not, it's not on the table. We're not coming into it with sickness. We're coming into it with our bodies prepared, with our bodies the way it needs to be. Healthy, strong, we're eating good, we're doing the things we need to do. When we come into our births like that, that's how we restore joy. Then you can focus on the fact that when you come into this birth, when you step into that delivery room, it's somebody's birthday. We're not in there now focusing on the woulda, shoulda, couldas, or what could possibly happen. Nope. And that's what we want to do. We want to affect change at the doula level, the level where we are interacting with the clients, the level where we are the change agents. That's where you want to affect the change. So yes, share this information, like, comment, all that good stuff. Again, my practice is Choosing Joy. Doula, lactation, childbirth services I offer. I'm located here in New Jersey. My website is www.iamchoosingjoy.net. And I am on Instagram as @the_RN Doula. I want you guys to have a great, safe Saturday, and go get a blood pressure cuff. I don't care if your blood pressure is 95/60. Go get you a blood pressure cuff. Know your baseline. That's the homework from this session for today. You guys take care. If I could figure out how to end this, somebody tell me how to end this. Let's see.